Yes. So let me take this opportunity to, welcome all of you for this beautiful evening that we are here together. Uh, we heard about the word hypnosis through movies, some books, or somewhere. At least I did, and it always made me wonder: how can I give my control to someone? It must be so scary, and I had a lot of questions around it. And whenever I saw that someone is hypnotherapist, I used to think, oh, I should not look into that person's eye. Maybe I will lose my control, and that worried me a lot, and that made me really search for people who can really help me understand what it is. If they call it hypnotherapy, what is this therapeutical angle to this? And that's how my journey to search for a trainer who can help me with this hypnosis and help me connect with my power of my subconscious mind, it began. And it was in 2013, I happened to meet this one person who's sitting with us, who started this meeting with us, CJ Jayachandar. I met him and we got into the discussion. And then somewhere I started wondering, maybe I can allow myself to trust and know more, because it is about knowing me. It is not about what the other person is going to do and what it is really. The conversation became so deep that I said, now I want to really take up this journey. I want to know, I want to learn. Uh, we kept on doing a lot of programs. People came in, joined. And yet I received a lot of questions from people. What is this hypnosis? What does it do? Isn't it scary? Or what's its usefulness? So today we are together for an hour to resolve all our questions, queries, and to know how is it useful for us. Because as uh, Jay Chandar, or Jay as we call him, he has been always talking about the usefulness of what we do. It's not about just learning something, exploring something, curious about something, but how do we use it? So it gives me so much of pleasure. The person who has been a trainer for quite some time, so many years, I think 2008 on, he has been training people in this world of hypnotherapy. And there are so many practitioners we have across India. So it makes sense for a person who has such a vast experience to help us. So apart from being a trainer, a facilitator for hypnotherapy, he is a master trainer for neuro-linguistic programming. He is a trainer for life coaching. And there are so many things we have been learning. Recently, we did a program called Brain Gym. When it comes to someone wanting a help, it doesn't matter what we are using, but how do they get help? But one of the subtlest and the most beautiful process is hypnotherapy, as I have experienced myself. And there are some people who have done here too. So it gives me so much of pleasure to relearn and understand more from Jay today. So Jay, it's all yours. Thank you for gracing us with this evening.
Thank you, Gayatri, and welcome everyone. There are a few people whom I know, I have seen, I have met, and there are other people I met to see and meet. So, first of all those people who are behind the cameras, can you take yourself out in front? Because this is hypnosis, so that I will know what you are doing, what you are not doing. Okay. All those who are in mobile phones, keep your phone somewhere stable, so that along with you, your mobile, I don't want your mobile to get hypnotized. Then you will be wondering whether you got hypnotized or your mobile got hypnotized, and then you will have a very crazy question in your mind: what is happening or what happened? Ashwin Kaur is there, Ruchi Gupta is there, Megha is there. Take a moment so that we can see you.
I'll just join. I'll just open in 5 minutes.
Yeah, take your time. All right. So, Gayatri, I got hypnotized by your intro. Or was it a trailer? Or was it a main picture? By the way, how many of you think that your life is like a movie? How many of you think your life is like a movie? You can unmute and say yes or no. No, this is not like one-side dialogue.
Yes, I think it is a movie. My life is a movie.
What about others?
Yes, sir. I also think.
Okay.
Yes,
What
sir,
about
like a
others?
movie.
Movie. What about others?
Yes,
Is your
sir.
life a movie?
No, I don't think so.
Okay, you don't think so that your life is a movie, all right? Then what about the story in your life that is happening? Or do you think, Preeti, do you think, I'll give you one more option for you to check and consider and let us know. Do you think that your life is a serial which runs for three years or 4 years?
Yeah, I mean, I see it as a journey.
Oh, you see as a journey. Okay. Right. You are sharing the whole. Okay. Interesting. The people who shared life is a movie, but others are so silent. Are you confused? Or are you still deciding?
नाही कन्फ्यूज नाही सर, पण इंग्लिश मध्ये व्यवस्थित एक्सप्लेन नाही करू शकत आहे.
Okay.
Huh.
So do you understand what a movie is?
We are only observer.
Now she had gone into a different plane. Observer. So look at how our mind plays its game. Huh? We are an observer. I asked, is your life a movie? Now,
Yes.
then I asked, what's the story that's going on now in your life? Can you take a moment and reflect? What is the story now at present is going on? Even though if it is a journey, what's that story that you are into? And what's the role that you are playing? Are you playing a mother role, daughter role? Are you playing a brother role, sister role? What role that you are playing? Are you playing a villain role or Billy role?
Thank you, ma'am.
What role that you are playing? Take a moment and let me know.
Maybe playing a role of struggler.
Playing a role of
Struggling man.
struggling man. Chitresh, did you say struggling man or?
Yes, sir.
Okay, struggling man. Thanks for sharing vulnerably. And that too, Ashwin, tell me.
I am playing a role of a daughter-in-law, a wife, such a huge task for me.
Yeah, I can understand. Daughter-in-law and then wife. Yeah. What about others? What role that you are playing?
माझी 2 तरुण मुलं आहेत घरात, 22-24 वर्षाची. तर एक आई म्हणून बरेच चॅलेंजेस येतात.
Okay. Amruta, I will ask Gayatri to translate it.
She says, I have two young boys and it's a good challenge to be their mother and manage.
Oh yeah. So what's your role that you are playing? That's good. Thank you. What about others? What's the role that you are playing now?
The role of a mother, daughter-in-law, daughter, a trainer, a friend. I think every one of us plays multiple roles throughout their lives. One role at one point in time, or maybe multiple roles at one point in time. It's a very tricky question.
Yeah, the way that you said everyone plays when I asked you, that's very tricky. Look at it. What about others?
I am playing the role of a daughter, sister, and a student, and a friend.
So each one of you playing roles in your own movie called Journey. Okay. Are you happy with that movie? I mean, are you happy with that roles that you're playing? Preeti, what about you? What roles that you're playing? It's okay if you say, or it's okay if you don't say.
No,
Because
so
you're
all the
happy.
roles. Yeah, so I'm being a female mother, daughter, friend, wife, everything.
Okay. Now this everything, everyone is tricky. Remember this. So in our terminology, in the second level, there is something called generalization. It's very tricky. Okay, now you have shared, I'm playing this role. What role that as of now you're playing is more impacting you? When Chitresh said, I'm a struggling man. Isn't it something impacting him as a man? He did not say like father or brother or son. And Megha said, after some few lists, after trainer, then she said that everyone. So what is that one role that you are playing that is impacting you?
Yeah, the role of a mother, definitely. I think that's the most impactful role that I've ever played in my life.
Yeah. So at this moment, is it impacting? Reflect.
Impact?
Yeah.
Yeah, impacting me, yes. If you if you put it that way, yes, it impacts me every second of my life. So, yeah.
Wonderful, wonderful. The impact can give a pain as well as pleasure, isn't it? If you take the roles, I'm playing a role of a father. My experience gives me a pain as well as pleasurable experience.
Yes.
There are only two major areas on which other things can be sorted out. One is pain, other one is pleasure. Now, if the pain moves up, then the pleasure moves down. If the pleasure moves up, pain moves down. It is like that. Have you ever experienced at the same moment both pain and pleasure? Have you ever experienced that? You feel both pain and pleasure?
No.
No.
Okay.
Because
Until you have
conflicting.
become, yeah. Go ahead.
Because there are conflicting emotions, pleasure and pain. I don't think it works together, but yes, it does for a few. It does for a select few who can explain their emotions of pleasure and pain at the same time, at the same moment, and they have experienced it.
Okay. So I asked your experience. Did you experience it sometime?
No, I said at the beginning. No, I didn't.
Okay. Okay. Thank you. Now, how many of you are aware in your day-to-day life about yourself? Let's say you are experiencing a pain or pleasure, right? In your role. The moment you have engaged, how many of you are aware that you are playing a role and something is happening and that is giving me an pain or a pleasure? How many of you are aware? Or you have got lost on that, means carried on that. Or the third option is you are assuming that you are aware. You are assuming that you are aware, but you get kicked in some kind of emotion like pride, jealousy, also like, kind of into anger, sadness, feeling of excitement. How many of you?
I could say I could relate, like, for example, the delivery pain, what we say, is the most painful for the ladies. At the same time, you can enjoy the pleasure that you are giving a birth.
Okay, Asha, thank you. So, at the same moment, the question is, if you reflect, at the same moment, do you experience the pain and pleasure? Is the question. Because giving a birth to a baby is pleasure. Okay, that's a different after that. But while you are going through the process of birthing, anyway, in hypnobirthing, we call it as birthing, not delivery, because we are not delivering any kind of package, okay, or the parcel. So hypnobirthing, we call it as a birthing process. It seems even the word that we use can impact you as well as the other person. Okay. Now, coming on to the question is, how many of you are aware in a moment in time? In a sense, you are in the here and now. The word is here and now. Or you got hijacked somewhere. It's like you watching the movie in the theater, and after some time, you forget that you are watching the movie. You are completely into that movie. That's called hijack.
Yeah, while watching a select few movies, I have been hijacked.
Okay. What about others?
While I'm playing the role of daughter, I assume I am aware, but I get into anger and other emotions. And while playing the role of student, again, I assume I'm aware, but I lose track of here and now after some time.
Good awareness. What about others? Because one has to be aware whether I am losing track of myself, or I have got lost, or I have got hijacked. That can be the first step for you. Amrita, would you like to share?
Most of the time while, yeah, please.
मैं जब एस्ट्रोलॉजी पढ़ रही थी तो उस टाइम पे बहुत बार ऐसे हुआ कि मैं अपना सारा कुछ काम भूल के मैं उसी में इंटरेस्ट ले रही थी और दिमाग में वही सब चलता था, तो मुझे लग रहा है वो एक तरीका हाईजैक ही था.
I got this Hindi. So
Okay.
this is not Marathi. I can understand. Thank you.
No.
Chitresh, yes, you were sharing something.
Most of the time, while when we are doing any work of our hobby, then we get lost in that.
So the question is, what is that one work or hobby you get lost into it?
Gardening.
Then what else?
It is gardening.
Okay. Ashwin Kaur, would you like to share?
So my life is like a roller coaster. Sometimes, around me, it depends upon the people's mentality or people's thought process. When they are when I am in my mood, they want me to be in their mood. Like they don't want to adjust with me what I am to do. So that is why I am a bit confused right now in my all the situations, because I'm neither happy nor sad. Neither right now I'm focusing on my health first rather than my mental state, because mental state only can be managed till my body is fit. Because I have to firstly fit myself, then I can understand those people around me, because most of them are toxic to me. Yeah. Because
Okay.
yeah.
So did you listen what Ashwin Kaur is sharing? You will get many things if you can listen. So if you can listen yourself, you can understand. First thing is, our life is a journey, is a movie called Journey. And then we all playing our roles. Are we aware about our roles? Even if you are aware about our roles, are we aware at that moment in time how we get hijacked? So coming on to how this relates with hypnosis. Hypnosis. How many of you had the experience of getting hypnotized? No. Okay, good. And what do you think, each one of you? Shraddha, would you like to share something? Or will you raise your hand, or who is that?
So you asked, have you experienced hypnosis? That's why I raised the hand.
Oh, okay. Thank you. Right. If I say every moment in time in your life, you are in a state of hypnosis. Even the people who are saying that I am aware most of the time, you are in the state of hypnosis.
Sir, because we believe that. We are this and we are that.
Okay. But we are in the state of hypnosis every moment in time. The whole this whole introduction is that. If you are reading a book, the moment you are losing yourself in the mood, you are gone. If you are hijacked in your anger or sadness or pride or some kind of feeling, sorrow or despair, or feeling abandoned or feeling unloved or feeling loved or feeling appreciated, it means you are gone. You are in an hypnosis state. If you are watching a movie or if you are going for a vacation, you get lost in the nature, it means you have been hypnotized. How many of you drive cars or some vehicle? Okay. So while you are driving, how many of you have got lost in your thought to somewhere else? Maybe in the past or in the future, or thinking about what to be done. It means you have been hijacked. Are you aware about it? So this course of hypnosis is first for you to understand and ensure that when are you getting hijacked? Ashwin says, someone, brings me into that. So it means that you don't have power, is it?
True.
Hmm?
True.
So it means you don't have power. Do you agree with that?
Yes, I agree.
So it means that when you believe that you don't have power, it means that you have got lost into it. Then what do you think these consequences will be in your life?
No idea actually. It's been so like irritated sometimes that I don't understand that what I am talking about, what I am doing, and what I'm thinking. Like it's like ki all the time I feel like, yeah, what is happening in my life? Like I don't understand what I was in my past before marriage and what I am after marriage. It's totally opposite. Like I was a very independent person. Now I'm a dependent person. So that breaks me. First of all, everything breaks me.
So this is how the consequence of getting hypnotized in our roles that we play and in our so-called life situations that we engage into, where we feel powerless, or rather I can say Ashwin as of now feeling powerless. Though Ashwin, you said that you were independent before marriage. It means that the power you had, where do you think you have lost it? And this is not only for Ashwin, it's for each one of you. Your future is based on what you are thinking now and doing now. Your present is based on what you thought, what you felt, what you did yesterday. Now, it means that most of the time when we are getting hijacked, we don't have a rational mind in place. Okay, I'm going to ask you one question with respect to hijacking. How many of you got into that state of anger and completely into that movement? How many of you? Okay.
Pardon, didn't get you.
Pardon, Chitresh?
Didn't get your point.
I asked how many of you get into that anger, total anger, where you forgot about your own self? I did.
I too.
Isn't it? So it means where was your rational mind at that moment when you completely got into anger? It means you forgot about yourself. By the way, after coming out of anger, that moment, after let's say 1 hour or 6 hours or a day, you start thinking about, oh my God, I behaved like this. I should have not behaved like this. This is so bad of me. How I could do this? This kind of thoughts. No, I'm such a qualified person on earth. I am so, I have this designation. I could have not done that. How many of you? Oh yeah, all silence. Welcome, Dr. Abhijit. Anyway, the movie, no? Yeah, welcome. You were about to say something.
Thank you.
So the movie is already 32 minutes past. So you'll get used to this in another 20 minutes. That's called hypnosis. But ensure that, I know that because we are in the Zoom platform, you will not wake the other person by asking what's going on. And if that person is totally engaged in the movie, they'll say, just watch, don't disturb me. That's the power of hypnosis. Huh? Okay, by the way, I asked this question. How many of you had thought about it after getting into completely into anger? But, oh my God, shit, I should have not. Next time I will not get into this. And then once again you repeat. Oh, by the way, the next approach I will share in the anger. How many of you say, I was really good, cool and calm, and that person, exactly, I know that. And he or she did. And that's the reason I got angry. Otherwise, I am the most wonderful angel or God or goddess on earth. How many of you? Oh, yeah. It means that your remote control is with that person. So whenever they want, they can trigger you. Is it so? It means that having the remote control, come on, yes, now I'm going to put you into anger state, come on, back. Then you get. It means totally hypnotized. Okay, there is something that we are discussing, that every moment in life, we are in a state of hypnosis. We are thinking that we are awake, but we are in a state of hypnosis. It is not that you watch a movie. There are people who deliberately watch a movie or a serial. You know why? To forget pain of the day from morning till evening, or the relationship. It means more hypnosis. They are weaving a web of hypnosis. And when I say hypnosis, hypnosis is a trance-like state of mind. Remember this. Hypnosis is a trance-like state of mind. It's not a sleep, it's not a wake state. It is an in-between state. And in that state, your mind is hypersensitive. It means even a small pin drop, your ears can hear, and your whole body can feel that vibration, even a small pin drop. And your mind is highly susceptible to suggestions. So, if that is the case, every moment when you are in a hypnotic state, whatever happens that your mind captures, that it is important, it becomes a suggestion going inside your subconscious. Are you getting this? And you know what we do? We talk to ourselves. I am this and I am that in that state. And that becomes a suggestion in our subconscious mind. And you know how long we have been doing this? The science says we have been doing this from our mother's womb. A baby in the mother's womb can feel what the mother is going through, and can feel inside. A beautiful story of mythology, if you consider it's a mythology, of Abhimanyu inside the womb. And the science is sharing it now. Inside the womb, the baby is a living being with all the senses active. So can you look out and see in your mind how much day in and day out you have been suggesting for yourself? Got hijacked in the hypnosis of the world. So hypnosis is a trance-like state of mind. It's a hypersensitive state, highly susceptible to suggestion. A simple explanation is, when you go to a store to buy something, you get hypnotized. Because if you go with your friend, one thing is you see that item and you hear to your friend and you also listen to the salesman, and then there will be something going on inside your mind. And then your memories will shift you back to someone having this, and there can be a comparison going on, and then saying, okay, at that moment, if your salesman says that, sir or madam, this will suit you. This is of much higher budget. And by the way, at that moment, if that pokes you deep inside your ego, you will not say what is going on inside you. You might have said, what did you say? It is not with my budget. Oh my God. There are many people in my life who had put me down in this. So I'm going to buy this and I will buy that. And later on, when you get a credit card bill or your bank statement, you realize that you have overspent it. And then you will resolve, from next time, I will ensure I will not pay or I will not do. And then once again, the story repeats. Because you are playing your role. You are playing the major character in the story, in your movie. A few things that I would like to bring now. One is, every moment we are hypnotized. And at that moment, we are not aware what kind of suggestion that is going inside our mind through our senses. How many of you had been aware from 6:32 till now? It is 7:10. I had been talking. How many of you are aware how many suggestions had got deep inside you? Or you had been as a gatekeeper or a security person to filter it and send. This I will send, this I will not send. How many of you? That is also hypnosis. And there is a science behind it. There's a science behind it. Now, some people I can observe you are going here and there. Some people, even though you are looking at me, something going on in your mind deep inside. I know that. Do you know that? That's a science. And when you know that, and when you keep practicing it under a supervised environment, you will learn. You will learn about yourself, of how you get inducted into hypnosis. And what are the suggestions that you take it? And which one to take, which one not to take. You can decide. So before that, you need to be aware. Even now, after I said, you can have a resolve. No, I'm going to shut everything, all my senses. My dear friends, you people are so lovely, I tell you. Because you want to understand your life as something over there is there. That's the reason you people are here, isn't it? Life is so beautiful, adventurous, journey, and it has a lot of experiences of your own, which is so special. And when you can understand yourself, you can also understand the other person. It can be your family member, it can be your father, mother, brother, sister, your husband, your spouse, or your children, and can support them in their growth. Okay. Now, let's do some experiment. Are you ready? I know that you people are in trance for this moment. How I know? Your body feelings, means your body sensation. Bring your awareness to your body. Scan your body for a moment. Scan your body for a moment. Take a deep breath in, each one of you. And exhale slowly. And for a moment, you can close your eyes so that you can become aware of yourself. And I can assure you that all the other things around you can be taken care. And it will be taken care. Inhale and exhale. That's beautiful. Be with your breath. Scan your whole body from your toe to your head. I know the thoughts will come and go. Allow it to come and go. That's okay. Because your relaxation is more important for you now. And bring your awareness to your feet, your ankles, and to your calf muscles. And say, I'm relaxing my feet, ankles, and my calf muscles are relaxing. My feet, my ankles, and my calf muscles are relaxing. All the other sounds at the background will fade away. It means that your mind has that power to just send it far, far away from you and focus on my voice and be with your feelings of relaxation. Because your mind is so powerful. That's good. Being with your breath, inhale and exhale. Relaxing your body. Bring this wave of relaxation to your knees and to your thighs. Say, I'm relaxing my knees and my thighs are relaxing. And more deeper you go, more and more relaxed you feel. More and more relaxed you feel, more and more deeper you go. Gently bring this wave of relaxation to your abdomen, to your chest and shoulders. And say, I'm relaxing my abdomen, I'm relaxing my chest, and my shoulders are relaxing. And every time you say it, it means you are taking care of your body. And as you take care of your body responds to you. And it is so special for you. Bring this wave of relaxation to your arms, forearms, palms, and fingers. The more gentle you are with your body, the more you can feel it and sense it. Become aware of your neck and your face. and head and say, I'm relaxing my neck, all the facial muscles, as well as my head. For a moment, relax it totally. Now, imagine yourself on a staircase of 20 steps. You're standing on the 20th step high above. I'm going to count you down from 20 down to 1. And as you walk down, you will be relaxing your mind and your body. This is the second level of relaxation that you are bringing in. And as you are standing on the 20th step high above, on your right hand side or on your left hand side, you can find a box, a beautiful carved wooden box. Open the box, remove all the pain and stress of the day and put it inside the box. Remove all the pain and stress of the day, put it inside the box. Close the box. There is a key over there. Just lock it. And then throw the key far, far away. It goes up and disappears. Now walk down 19, 18. Deeper and deeper, relaxing your body and mind. 17, 16. Deeper and deeper, relaxing your body and mind. 15, 14. Say yourself, I allow myself to relax. I'm relaxing. 13, 12. 11, 10, 9. See yourself in a beautiful nature-filled surroundings that you love. See yourself in your mind. Let's go. There can be a landscape, it can be mountain, or it can be in the woods. Listen to the sounds of the birds chirping. Feel the breeze. Relax yourself more deeper. And enjoy this moment of yours. Enjoy this peaceful moment of yours. And say in your mind, life is so beautiful. I love my life. Life is so beautiful. I love my life. I have all the power in me. I have all the power in me. Life is so beautiful. I love my life. I have all the power in me. I have born here to live my life. I have born here to live my life happily. I have all the power in me. My life is beautiful. You will not listen to me, but in this silence, keep saying in your mind, alive, allow my life. Life is beautiful. I have all the power in me. Keep relaxing. I'm here. Keep relaxing. You are safe. You are safe. I'm here. Keep relaxing. Right. Slowly become aware of your body. 1, become aware of your body. Come back. 2, scan your whole body from your head to your toes. Scan your body. 3, rub your palms. Bring your palms together. Rub your palms. Cup your eyes. Massage your face. Slowly massage your face. Open your eyes. Wide awake. Welcome back. So take a moment to have some water. If you don't have, you can bring it now from wherever it is. Have some water. So how was your experience? What was your thoughts? What was your body sensations? And yeah. You can unmute and share briefly. Go ahead, doctor.
I was completely relaxed and there were hardly any thoughts, or I was not noticing them otherwise.
Yeah, good. Completely relaxed. The body level and in the mind level.
Yes, both mind and body, and I'm feeling energetic.
Yes. That's one of the benefit of hypnosis. Others?
So I initially experienced pain, especially in my heart, because of things I went through this last month. And after locking them in the box, I felt better. But thoughts, the mind was wandering all over. But body sensation were better than before.
Yeah, when you have some unresolved material, the mind keeps moving. Look at that. Gayatri was yawning. If you're not absorbed, then this would have shifted you. This would have waked you up. Yeah. When there is a material that keeps coming and going, that's called the interference of our mind. That's an unresolved issues. And by the way, when you keep doing this under supervision, you will learn many things about your own self. And you can access it from the deep subconscious, because the pain and pleasurable memories are there stored. Our experiences are recorded like this black box inside the aircraft. It's so beautiful. The moment you unlock it, a lot of things come out. Yeah. And Freud calls it as unconscious. What we call it as subconscious. And most of the time, it goes inside. It means it tries to come out, but we suppress it. It tries to come out. It will show, you know, hi, it calls, hi, here I am. Can you take care of me? I need love from you. I need your attention. Hello. But in your day-to-day life, or janjat, or the so-called assumed illusionary situation, when you got hijacked, you don't take care of your inner you that's coming out. When it is not resolved, then it is going to do a lot of things in you. Like all kind of emotions, not able to handling the situation, less confidence, confusion, dependency or over dependency, or violent behaviors. Gayatri, can you message to the waiting room people? Because I don't know who is that person, 1+ not, for them to rename. Okay, what about others, your experience? Go ahead. Deepika is there. Rutuja, you go ahead. After that, Deepika. Yeah. I can't hear you. Or we can't hear you. Can you remove the jack and see?
Yeah, now can you hear me?
Yes.
Yes, so I was in a half asleep state. It was a very nice, relaxing state, but I got distracted by my dog barking because the bell rang and he was in my room, so he started barking a lot, very loudly. It was very annoying at that point. So after a few minutes, I came back when you were instructing about being in a nice environment. So that was a nice part. I was imagining a place which I've been wanting to go to. So yes, and the thoughts, in the beginning, the thoughts were coming, but they started slowing down after a point. And when I was in that half asleep state, there were no thoughts, like almost no thoughts.
Thanks for sharing. So it is like sleep. When you are in a deep sleep and someone asks for the keys, or someone knocks the door, you go over there and then open the door with that half sleepy state, right? Not aware whether you are wearing your clothes or not, and then come back and sleep. Okay, it means that the trance, once is there, it continues. Okay, and when you are doing self-hypnosis, by the way, you will be learning self-hypnosis in level 1 clinical hypnotherapy program, and you can also teach it to your people over there, and we will give you what you can do. So while you are doing that, it is also essential to instruct that they allot some time, 15 to 20 minutes, where they are not going to get up. Because remember that any other message that is going to come, our mind is in a hyper suggestible state. Okay, it directly enters into our subconscious mind. Are you getting that point? Yeah. Yes, Deepika, can you unmute, and can you also have your camera on so that we can see you? who you
So,
are.
yeah. Sir, actually, I'm traveling, so can't keep the video on. There is no proper network. Sorry
That's
for
fine.
that.
That's fine.
But I would love to share the experience. So, as you were instructing, I was like just following whatever you were saying, and I was enjoying so much. Like, the best part is when you asked me to come down to the steps, I was like, I don't want to look behind. Okay. And when I came down all through the steps, I was like feeling awesome, and awesome in terms of like, wow, this is what I want to be here. Okay. And then again, there was a feeling that I don't want to go back. And then when you asked to, rub the hands and, feel the power we have, it was like, I don't know, somehow I felt my skin is not my skin. I mean, when I touched both the hands, rubbed the hands, it was like it is something else. It is someone else. Right. So when I touch one hand to the other hand and rub, so wo kuch ajeeb hi feeling thi, and it was really a lot of like different, unique feeling. I don't know. Matlab, this is for the first time I felt this is someone else. I touched someone else's hand like that.
Wonderful. It means that though I have given 4 suggestions, that one word power, your mind attracted it. And
Yes.
you find benefit out of it. It means inside you, there is a need for that in the role that you are playing, in the situation that you are. Okay, I would invite you to reflect on that so that you will understand what is happening in your day-to-day life. Hypnosis is all about to understand our programming that's been happening. Thank you, Deepika.
Thank you, sir. Thank you so much.
From the day one in our mother's home, we have been constantly bombarded with a lot of suggestions. You are this, you are not this, you are useless, you are stupid, you don't do this, you are not worth it, you cannot do this, you can do this, you are so powerful, you are good, you are awesome, you are magnificent. And as a child, when the child is not ready, it means that sponge, the brain, the sponge, absorbs everything because it cannot judge what is good and bad. In second level, you will learn the stages of development. What age the child can understand what is good and what is not good. And before that, it's programmed. Do you know that by 6 years of age, we all have designed our life? Means we have decided what we are going to do. Do you know that? And there is a blueprint map that is over there in our mind. That's been set. And how do we decide? Based on the circumstances, based on people significant people interactions. And we have decided. And we start playing it in our lives. And whenever that circumstance comes, we get triggered. It's called stimulus. And we respond to the stimulus. That's a word, stimulus and response, coined by Ivan Pavlov. The classical conditioning process. Now, without your awareness, when you start reacting to the stimulus, it means you have become a remote control toy. And in the process, you understand what is the stimulus, what is that my reaction. And in the second level, there is something called regression, where you go to your younger you to understand what are the useful things and non-useful things that has got programmed. Now, my dear friends, you have the ability in this age to re-decide for your life. For that, you need to know, we go by the circumstances and the situations, what is that you are doing and what is that you want to do. And how it is blocking you, holding you, trapping you, suffocating you, not allowing you to have your potential outside. So I used to wonder with this quote of Swami Vivekananda. We have all the potential. We are divine, we are potentially divine. And we have all the potential within us. But the question is, we are living like frogs. Assuming that some princess, some Santa Claus will come and save. And our life rolls out. And only few, they convert themselves, they transform themselves from frog to princess or prince. And that's the transformation. And in psychology, it can be called as self-actualization, based on the model of Abraham Maslow, existential psychologist. It's so beautiful. Your life is beautiful. Your life is in your hands. Your life is in your hands. The key is in you for you to unlock. And you are so special. You are so special. And when you discover yourself, I'm using the word discover. It's called discovering. It's like lifting the cover. When you unearth diamond in you, the world can experience you differently. And before that, you will start experiencing differently. All the bondages, like the chains binding you, will disappear. It can disappear all of a sudden, or it can disappear one by one, because you have discovered yourself. All the superheroes are there inside you. All the superheroines are there inside you. You are the hero and heroine for your life, because your life is in your hands. So this program is so special. I'll be giving you the overview of the program. It's of 3 levels: level 1, level 2, level 3. Level 1 is for 3 days. Level 2 is for 5 days. Level 3 is for 8 days. Level 3, there is a criteria. The special criteria for level 3 is one has to have a medical or psychology or a paramedical qualification to practice clinical hypnotherapy. Okay. If you are not having a degree, you can have that. We will guide you. We will mentor you appropriately. But if you are not going to pursue any kind of degree, there are options now available in India. You can do that. To practice clinical hypnotherapy, level 3, you need to have the degree. Level 1 and level 2, anyone can learn, anyone can practice, and anyone can use it in your life. For you, for your friends, you can apply it in across your area of work, like training, teaching, management, leadership development, performance development, sports management, counseling, therapy, coaching. It's limitless. Okay. So first level is all about the foundation. You will learn around 12 techniques to induct. Induct is inducting the person into hypnosis, because every other person has their own mind, has their own thinking process. There is no one good script to induct. First, you need to understand what is this person's mind about. Okay. In between black and white, there are 50 shades of gray, according to some book, but there are more. So first thing is you understand this mind of what? So that there comes the science to calibrate, to test. And then there is a process to induct. Some are direct. The moment you say, they'll go this. Some are indirect. The moment you say direct, their mind will ask one question. What is that you are saying? That is how they are conditioned. And there are other people. They don't trust you or they don't trust themselves. Okay, all these things you will learn in the first level. And then there are inductions, the 12 inductions. How to effectively induct. What potency has to be given? How much? Because if you induct more, there will be like a deadlock. Even when you are saying wake up, wake up, wake up, they will be like deep into the trance. And if you are going to give very less amount, someone may not get into the trance. There are also people who get into the trance and they say, you know, it's only 50%. I am not gone into that. And when you ask them, when compared with what? Because when you learn this in the program, you are going to use this in your application part. When you are inducting someone. And when you experience that with your client, oh, I have not got that effect. So what is that effect? Like sleep. Now I have this crazy thing to share with you. When person say that, I say, you are paying money to get some change in your life, not to sleep. So better you can go to a 3-star hotel or a 5-star hotel, book a room and sleep. By the way, they can't sleep, they know that. It's so simple, isn't it? So hypnosis is not sleep. And the program builds that knowledge inside you, the skills inside you, because there is demonstration to observe and to emulate. And there's a supervision to understand where to say what, where to do what. There are certain behavioral skills while inducting. And when abreactions comes out, how to notice into what level, till what level we can handle, if you are capable enough. Because you need to know where you stand. Because the safety of the client and you is important first. All these things will be taught. And then what are suggestions? What's the framework to give suggestions? And what's the difference between suggestion and affirmation? And what are beliefs? What are thoughts? What are emotions? What that person is struggling with inside, that you need to identify. That is the core in the first level. Second level, you will learn, it's an advanced level. You will learn advanced techniques of indirect hypnosis. It's like being with them, sitting with them, you can engage them into a conversation and you can take them for a journey. And by baat karke, you will know what you are doing because there's a step-by-step procedure. You know each and everything that you are doing at this moment in time. This is what you are doing. This is what the client is going through. And you will test what kind of depth that person is in. Whether that person is in cataleptic 1, 2, or 3. Whether the person is having a positive hallucination or the person is having a negative hallucination. Or they are in an analgesic, anesthetic stage. Or which level they are in. Or they are in light trance. How to gauge it, how to calibrate it, because it's so defined precisely. And then you use it profoundly. One thing is precisely, the second thing is profoundly. And more than 14 techniques. Hypnosis is not only suggestions, my dear friends. It is going deep inside. There are sub-personalities. There are parts, we call them, sub-personalities, which brings in conflict. How to bring them, how to integrate them, how to understand them. There are deeper level beliefs that we have got it from many people. How to understand that belief, how it is stopping, how it is limiting, from where you have got. There is an age regression. There is an inner child work. There is child within each one of us, which is so longing. And when your child is craving and when it is needing for something, and when you are not responding to it, it means it may not be good. You may not be having a joy or happiness in your life. Are you getting this? When your child, either you become a workaholic, right? Or you fantasize yourself into some dream world, or you have goals, you may not be reaching that goals, or you will start blaming people or defending yourself, or 85% of the illness are psychosomatic. When the emotions are unresolved, when you find difficulty in speaking with your people, or with your boss, with your spouse, or negotiating, having an open conversation, when you get stuck, when you get frozen, that shows in your body as pains. It's called psychosomatic ailments. And second level, you will also learn about beyond age regression. Is there something called past life regression in a scientific way? Because until you experience, how will you know? You will learn it. And third level is all clinical. It's all clinical, completely clinical. Like bulimia, sexual dysfunction, premature ejaculation, all those things. Handling rape, incest, those kind of things. Trauma, fears, phobias. One thing for sure. We invite you to experience. You can start with the first level to understand yourself more. And that will be useful for you. And then you can decide, because there will be a lot of practice for you, and there is opportunities that when I'm doing a demo, you'll be part of that. And there will be a lot of awareness, my dear friends, of your conscious, of your subconscious, of your overall mind. So this is where it is. Okay. Any questions from your side? Any thoughts from your side? Questions, thoughts? Okay. Now, because there's a lot of silence.
Everyone became
Yeah, they are in their own
clear
world.
of what you shared.
It's so relaxing, by the way. It's like having an ice cream and the favorite ice cream along with the sweets. It can be anything, right? It can be jalebi, rabdi, or it can be kala jamun, or it can be jamun, or it can be fudge or mousse, or anything for that. Okay, do you like to experience the power of your subconscious, this moment. Yes, Deepika.
So basically, it was not like that, no question, but it's like I have so many questions. So I was thinking whether to ask or not. So, like, one question is in my mind. As you said, we have power, right? So, and we are playing so many roles in our life, right? So, like, my question is how to understand which role to prioritize. And the problem is, if I want to give like my 100% to each role, this is not possible.
Wonderful question, Deepika. Your question has an answer. First, understand who
Okay.
you are. First, understand who you are. Experience that power in you. Power is not going and shouting.
Right. But
power is not blaming. Power is not controlling others. So you are playing your roles, right?
Right.
So it is you playing your role. Do you know
Right.
about yourself? And your
About
programs.
myself, as in as we. Yes.
And your programs deep inside.
So as we say, we are playing different roles. So who we are into different roles, right? So detached from that, we need to understand who we are, you mean to say?
Yeah, there has to be a self-journey. In the process of meditation and the so-called self-realization, that's a self-journey. Even there, one has to meet with a proper master or a guru. Means they are the person that's been tagged as of the Oriental countries. Yeah, Oriental nations are considered. That's been tagged as, okay, master or guru who had experience so that they can guide you properly. Okay, here there is a knowledge because we follow a Western approach. In the Western approach, there is a theory, there is a concept behind it, which will be shared. That is called knowledge. And then there will be your experience, so that you are going to experience of yourself as well as with others, what is happening to them. So that will add on to your knowledge so that you can apply it in your life. So it is like uncovering yourself. So though you play many roles, it is you who is important. When you are saying 100% in every role, so will you also notice that when you want to say no, you can say no, or you want to say yes for everything at every moment in time. Yes, Chitresh.
Yeah.
Have a fantastic day. Thank you. See you soon. Yeah, tell me.
Yes. So no to, yeah. So the role which I don't want to play, yes, that is a complete no. There is no confusion. But I was like, how to prioritize in the roles we are playing.
So that is what they are deep inside, got programmed in you. Okay. So that deeper level of programs has to be. We learn from our parents, father, mother, and significant others, and that is very much programmed inside ourselves.
Need to unwind that. Need to learn and understand.
Learn, understand, unwind. If it is not possible by self, then take a person, therapist, counselor. Yeah, that is one of the way. So that you can accelerate your success. Okay. Did I answer your question, Deepika?
Yeah. Thank you, sir.
Welcome. Okay, for everyone here, do you want to understand the power of your subconscious? How many of you believe? I want others to open your camera for the moment. Everyone. Deepika said she is traveling. That's fine. Others, keep your cameras open so that I can see you. Yeah. Rutuja, Gayatri, Asha, Megha, Kirit, Deepika, okay. Meenakshi, Amit Desai. Right. So you can have your hand this way, like this, and start moving it from A to B, like point A to point B. Yeah. For a moment, move it. It's simple movement, no? You did that, right? Wow, excellent, man. Excellent, you guys. Now say clap, clap. Yeah, you did it. So close your eyes and open it. You did it, right? Fantastic. Fantastic, you people. Fantastic, you people. You have complete control of yourself. Now what you do, have your hand like this. Have your hand like this. Okay. Blood is flowing. There are arteries, there are veins inside. Is it there? If you say, I don't know, then you can go to an hospital after this program and ask them to cut and check whether there is an artery or vein over there, right? So that you get your doubts clear. So there are blood that is moving, right? Right. Now what you do, touch at a point in your forehead. Touch anywhere. Touch at a point. Touch at a point. Touch it and say stop. Say stop. Did it stop? You can ask me, your mind can ask me, what this insane crazy thing, yeah? You are asking, how will you do this? Okay. Now, bring all your anger, no? Bring all your anger now. Let's do one more thing. Bring all your anger. Means imagine 3-4 people in your life who always, you feel so angry about, you get pissed off. Imagine them, bring them, or the name. Some people even name total body will boil. That is what they say. Bring them in your mind and feel that anger. Okay, feel that anger and say, okay, I will stop my breath. Let my lungs stop. Say that. The total gussa hana hai. Don't say, let my lungs stop. No. It means you are acting, pretending. Bring all your anger and say, let my lung breathing stop now. Do that. Did your breathing stop? You don't have the power, boss. After you eat, no. After we eat. After this program, you go and have a chai or you go and have some snacks or during your dinner time, become aware for a moment. After you eat, the moment it passes 1.5 inch tongue, you don't have any control. Do you know who is managing it? Your subconscious mind. Are you getting an idea? In brain, there are centers. Now the science they are researching. When this happens, what happens in the brain? When that brain region is triggered, what happens within us? What kind of memory? Which region is activated? There is hypothalamus, there is limbic brain, there is cerebellum, there is medulla oblongata, there is cerebrum, there is frontal cortex, there is temporal brain regions of the brain. All these things you will learn, since you will have an idea. Our subconscious is so powerful. And we are not using even the tip, 1% of our subconscious. We are not aware. We are just living our life just like that. Right. So with this, I will stop here. So any questions, any sharings, it's from your side. I know that it is 8. I deliberately did that. Bringing your awareness back to say that we have 30 minutes past 7:30.
What is the difference between trance and sleep?
Oh, difference between trance and sleep. Once your mind keeps being in the beta state, when you get into an alpha state, it is like trance-like state. And once you trance, you will get transcended into sleep. That is theta state. It means that before you sleep, you get into a trance. And most of the time, you don't engage yourself over there. And the moment you come out of sleep, you are in a trance-like state. It means like, okay, slowly you'll be lying down with only a kind of calm mind, listening and hearing to people what they are saying, or even you are using your restroom, you'll be in a kind of trance-like state. And you will learn the states, how to bring that states in you and others very easily.
Thank you, sir.
Thank you, welcome. All right. So is it right time for us to say bye if there is no questions? So we would like to hear from you. How was this 2-hour session engagement with you? What did you learn, or what did you take away, or what did you get? Yes, Kiran, go ahead.
We learned a lot from it.
Thank you. Others, wake up, guys.
So
Your life is still there. Wake up.
I again, like, I mean, relearn that the power of my life is in my hands. I just need to wake up to my reality to understand that.
Yeah. That is the first step. That's the first step. Until you decide, no one can decide for you.
So can I ask?
Yeah.
So what is the difference between meditation and hypnosis?
Okay, meditation is where you sit on your own, where you sit on your own and go into a deeper layers of your mind, or to a calm state. Usually people get into a sleep state and feel that they were in the meditative state, because they would have done a lot of work from morning till evening and got into all kind of stress. The moment they get a calm place, they will sleep. Okay. So meditative state is completely a state of awareness, where I can notice my body sensation. I can also be aware of what's my thoughts, feelings, and other things that's going on inside me. That's the state of
meditation. That's meditation.
Yeah.
Now, what about hypnosis?
Hypnosis is a trance-like state. It is like you induct a trance.
It's the same one and the same word.
Let's say in meditation, you get hijacked in your own stressful emotion. Let's say some issue happened with your boss today morning. Okay. And you have got into that issue. Then you are into a trance. Okay. In hypnosis here, you are learning how to induct in a scientific method. Not you are going unconsciously, unawarely in your own getting hijacked in your issues. Here you create it deliberately so that you can work with your issues or for your goals. Okay. Usually, my experience in meditation with the people around, I have been sharing and teaching meditation for nearly 2 decades. Okay. People sleep and they come and say, I feel so relaxed. I feel so energetic. Wow, what a meditation. And nowadays, almost all the meditative procedures are guided visualization. It's also a trance, inducting. So, it is not meditation.
It's hypnosis.
Yes. If it is a guided trance like inductions, then it's an induction.
Thank you, sir.
Welcome. Meditation, simple technique, watch your breathe and stay with your breathe. That is simple technique. Okay. And not that easy to do that. You know that? Your mind will take you for a ride. And you will feel bored. And your mind will come and ask you, my dear Kiran, what are you doing with your life? Your life is staying outside the door. Are you acting or are you doing something? Then you will jump up from that seat and want to go out into the life to get into that illusion of trance. Okay. Yeah. By the way, you will learn this. You will learn. So we invite you, learn it in a proper way so that it will be useful for your life, even as a meditator. Right? Knowledge, skills are very important.
Yes, yes.
Very important. Next, who else would like to share? Yes, doctor.
I got an awareness that hypnosis starts very early, and it has a deep influence on my mind ever since I was yet in the womb of my mother. And with this awareness only, those conditionings can be broken.
Yes. Today I had a client. This was the third session. Today, not today, on Sunday. That was the third session. I was doing other procedures for 2 sessions, other interventions. And then in the third session, when I regress, means when I facilitated the client's regression, she goes to a point where she was as a baby from the womb, and she said, my mother is crying and she is feeling sad. So I asked her, so how do you feel? She says, I feel sad. Okay, sad for what? My mother wanted a boy child, I'm a girl. That's a very strong belief. And in TA, it is called injunction. Can you understand how much it can impact her whole life? I'm sharing only a small piece. By the way, there is no one to blame here, mother, father, or anyone. It is the child, how we took that, how we interpreted it, and how we stored it. This also you will understand in the program. So simple. This is a wonderful area of work. Yeah. Who next?
I have a thought. I'm not sure about how to decide if I want to do this. Like, I find it interesting. I am doubtful about usefulness of it for me.
Yeah.
Yeah.
Yeah. I know that because there were few programs you attended. This doubt is like, it's also conditioning. I know that. And what I would ask you to look into, I am deliberately not using hypnotic language, Rutuja. Okay. Ask you to look into, when you said usefulness, list out what are the benefits that you want and get in touch with Gayatri to have a conscious level understanding. Okay. And then my second line of thought is, until you experience, my question is, how will you know? To experience, you have to spend some time and money. Otherwise, it's also an imagination of the mind creation, which is also an mental hijack. Is it clear for you?
Yes.
Yeah. So that's your conscious decision. Okay. And for sure, the acceleration happens because we have tremendous potential. And final one was suggestion. It's a general suggestion for everyone. What I said was conscious, deliberate, conscious action for you to become aware that that was a suggestion. Okay, Amruta, go ahead. You have to unmute Amruta. What's happening? It's getting muted. Unmute yourself. Yeah, now you can speak.
एक बार वापस क्वेश्चन पूछे.
Yeah.
What are your learnings? या प्रोग्राम आत्ताच्या ह्या सेशन मधनं काय मिळालं तुम्हाला?
सगळ्यात महत्वाचं सबसे पहले मैं बोलूंगी कि बहुत इजी वे से आपने हिप्नोटिज्म के बारे में बहुत कुछ बताया है और ये मुझे बहुत ही इंटरेस्टिंग लग रहा है, तो मैं तो डेफिनेटली आपका ये कोर्स ज्वाइन करूंगी.
Thank you. So have a conscious decision and that is worth it. There are many trainings outside. These trainings are for you. And we are also clear that by third level, there is a criteria. You have to have your paramedical graduation, which we will mentor, no problem. Okay, what about Amit Desai? So there is silence. So would you like to share, Gayatri, something to end this?
So any questions, queries? We have a detailed PDF syllabus of this program, which we will be sharing with each one of you. And from 17th June to 19th June, we are doing this program live in Pune. This program cannot be done online. It will be done in person only, so that the learning is in depth and the experience can be, for us to observe keenly. So there's a lot to learn and a lot to enjoy and experience. This is a criteria for the people who wants to also learn past life regression therapy. So in the month of August, we are also doing the level 1 of specialization of past life regression, for which doing this level is a must, so that you understand what is this mind and get into the depth of your learning directly into the past life regression, rather than once again wondering that what do I do, how do I do. Because it's a 4 days program that will happen in the month of August, which also has a lot of insights about self and how the whole thing, because we carry a lot of concepts about past life, at least I did when I did join the program. And for this, there is an invitation. I'll share the details. We are there available any point in time. Ask your questions, get the clarity. And we're all welcoming you for this journey. Thank you for your patience, because the program time was for an hour and we are extending this much and you were there present. Yeah, Dr. Abhijit, you want to say something?
Yeah, how often do those programs repeat?
Not really. That's not based on the...
After 2 years, after 2.5 years, this is our first program. And we are also very specific and clear who can learn this, because in my 20 years of my journey, I'm mostly focused on academic and therapeutical, because hypnosis is a science. It has gone into some other direction where, if you ask me what we have done, myself and Anuradha, in this past 20 years, we have guided MSc nursing students in the natural birthing process, and there's a thesis been two theses been submitted at Rajiv Gandhi University of Medical Sciences. And when someone asks what we have contributed, there are many people, psychiatrists come and learn, and they are successfully practicing. And in Pune, we have around 5 certified clinical hypnotherapists. When I say 5 certified clinical hypnotherapists, they have gone through that rigorous process. So what is that rigorous process? Once you complete the level 3 of CHT, you have to work with 10 cases, and every case you have to work minimum 3 to 4 sessions, and you have to bring it for the supervision, and you have that supervision. That material has to be in the boundaries framework of hypnosis and the criteria, and then a thesis will be made and you submit it. And by the time you submit it, you are clear. Means you are ready to go and engage with the client.
Yes.
And there is ethics and standards where our basics is with GHHC, General Hypnosis Standard Council USA, means UK. I had been members with many organizations. Now I say that, okay, GHHC UK. Okay, and once you have done this program, you can get membership anywhere on this earth.
Is there any central regulatory body kind of a thing in India?
In India, there is a government order which has been passed in the year 2003 that it can be, it is a therapeutic modality, and it has to be practiced only by the paramedics and medics.
Okay.
Or under the supervision of them.
Yes.
So as
And
the program
pardon?
No, I just, because he asked a question whether, how often do we repeat? So the thing is, as we progress, like the minimum 6 to 8 people are there new, there are repeaters who will be studying, then the level 2, when practice is done, appropriate practice is done, then the level 3. And then simultaneously, as we see that there are inquiries and people who are coming up. So it's not a run of a meal that we do. It is majorly on how we want to engage the practice into it. That is how we have been practicing, at least in Pune 2016 on. This has been happening in Bangalore, in Chennai, and other places. Dr. J has been taking it.
Okay. One more question. Sorry about that. Are any of the trained people conducting hypnobirthing?
We are not doing hypnobirthing. We invited people from a long time back. Now we are not inviting them because they are also not that much interested to be here. Kirit, if it is okay for you, we can have a photograph. Can you come on camera, everyone, so that we can have a photograph? I invite everyone to come on camera. So meanwhile, Doctor, hope I answered your question.
Yes. Thank you, sir.
Okay, I have clicked the shot. Okay, that's fine. So see, our focus is academic engagement. Okay. For a long time, we have not been focusing in some other kind of, making workshop run or this and that. We don't do that. So we are very clear. The cohort, if it is 4, 5, 6, 7, 8, we are very clear in delivering that. But when it comes to level 3, we will be expecting around 10 plus. In the first level, our minimum is 6 plus because they can learn, practice and learn. Learning happens when you practice with someone. Otherwise, learning won't happen. And this is a psychological process. We are very clear what we are doing because we cannot grandiose it or we cannot discount it, right? So that is not the way it is. It is like, so we believe that are we grounded first? Are we in our emotions? Are we very clear? In our mind, where are we? So I get supervised. Even now when I do a session, I get supervised. So this is for you. I have my own therapist. That's a very clear-cut process. Yeah. Shall we end our sessions here?
Yes.
Thank you so much. Have a great day. See you all soon. Wonderful. I love it.
Thank you, sir. Thank you, sir. Thank you, madam.
Thank you.